Want to score over 850 in your MedSurg HESI? Then let's get started. Today we'll be covering 10 questions on positive end expiratory pressure. Question 1. A client with acute respiratory distress syndrome is receiving mechanical ventilation with PEEP. What is the primary purpose of PEEP in this situation? To increase tidal volume, to decrease airway resistance, to improve oxygenation, to prevent ventilator-associated pneumonia. Pause the video and select your answer. The correct answer is C, to improve oxygenation. The primary purpose of PEEP in ARDS is to improve oxygenation by recruiting collapsed alveoli, increasing functional residual capacity, and reducing intrapulmonary shunting. You can go through the incorrect options to help you understand. Question 2. The nurse is caring for a client receiving mechanical ventilation with PEEP. What assessment finding indicates a potential complication associated with PEEP therapy? Increased blood pressure, decreased heart rate, diminished breath sounds, elevated peak airway pressure. Pause the video and select your answer. The correct answer is D, elevated peak airway pressure. Elevated peak airway pressure can indicate overdistension of alveoli and increased risk of barotrauma, a potential complication associated with PEEP therapy. Question 3. A client with acute respiratory failure is prescribed mechanical ventilation with PEEP. Which nursing intervention is essential when applying PEEP? Ensuring endotracheal tube cuff inflation, monitoring for signs of pneumothorax, administering bronchodilator therapy, elevating the head of the bed to 30 degrees. Pause the video and select your answer. The correct answer is B, monitoring for signs of pneumothorax. Monitoring for signs of pneumothorax is essential when applying PEEP because increased airway pressure can predispose to barotrauma and pneumothorax. Question 4. The nurse is caring for a client with acute lung injury who requires mechanical ventilation with PEEP. Which assessment finding indicates effective application of PEEP therapy? Improved oxygen saturation, increased respiratory rate, decreased lung compliance, elevated arterial carbon dioxide levels. Pause the video and select your answer. The correct answer is A, improved oxygen saturation. Improved oxygen saturation indicates effective application of PEEP therapy, as the primary goal of PEEP is to improve oxygen saturation or oxygenation in clients with respiratory failure. Okay, guys, you got this. We're halfway there. Question 5. A client with pneumonia is receiving mechanical ventilation with PEEP. Which complication should the nurse monitor for in this client? Hypertension, pulmonary embolism, atelectasis, barotrauma. Pause the video and select your answer. The correct answer is D, barotrauma. In a client receiving mechanical ventilation with PEEP, the nurse should monitor for barotrauma, which is a potential complication associated with elevated airway pressures. Barotrauma can lead to lung injury, pneumothorax, and other adverse effects. Question 6. The nurse is caring for a client who is receiving mechanical ventilation with PEEP. The client suddenly develops hypotension and decreased urine output. What complication associated with PEEP should the nurse expect? Pneumothorax, ventilator-associated pneumonia, abdominal compartment syndrome, hemodynamic compromise. Pause the video and select your answer. The correct answer is D, hemodynamic compromise. Hemodynamic compromise, such as hypotension and decreased urine output, can occur as a complication of mechanical ventilation with PEEP due to reduced venous return and increased intrathoracic pressure. Question 7. A client with severe respiratory distress is receiving mechanical ventilation with PEEP. Which parameters should the nurse monitor closely to assess the effectiveness of PEEP therapy? ABG levels, serum electrolyte levels, white blood cell count, urinary output. Pause the video and select your answer. The correct answer is A, ABG levels. Monitoring ABG levels allows the nurse to assess the effectiveness of PEEP therapy in improving oxygenation and ventilation. Question 8. A client with ARDS is receiving mechanical ventilation with PEEP. Which complication associated with PEEP therapy requires immediate intervention? Increased intracranial pressure, decreased serum potassium levels, pneumothorax, elevated blood glucose levels. Pause the video and select your answer. The correct answer is C, pneumothorax. Pneumothorax is a potentially life-threatening complication of mechanical ventilation with PEEP and requires immediate intervention such as chest tube insertion. Question 9. The nurse is caring for a client receiving mechanical ventilation with PEEP. Which intervention is essential to prevent complications associated with PEEP therapy, encouraging coughing and deep breathing exercises, administering intravenous sedation continuously, monitoring for signs of ventilator associated pneumonia, maintaining proper endotracheal tube cuff inflation? Pause the video and select your answer. The correct answer is D, maintaining proper endotracheal tube cuff inflation. Maintaining proper endotracheal tube cuff inflation helps prevent complications such as aspiration and ventilator associated pneumonia associated with mechanical ventilation, including PEEP therapy. Congratulations, you made it to question 10. A client with acute respiratory failure is receiving mechanical ventilation with PEEP. Which finding indicates a potential adverse effect of PEEP therapy? Decreased oxygen saturation, increased peak airway pressure, elevated tidal volume, improving lung compliance. Pause the video and select your answer. The correct answer is B, increased peak airway pressure. Increased peak airway pressure may indicate overdistension of alveoli and potential adverse effects such as barotrauma associated with PEEP therapy. Click that subscribe button and join us every Monday for a new video.